I am so excited to have Krystle Zuniga with me today for this episode at Ask the Patient Advocate podcast. Today, we are talking about a crucial topic for many cancer survivors, nutrition. And I'm so happy to have a very special guest with us. Dr. Zuniga is a registered dietitian and board certified specialist in oncology nutrition. And I know from experience with all my patients and clients that nutrition is so important when it comes to oncology. Dr. Zuniga is the founder of Cancer Nutrition HQ and brings over 14 years of experience helping cancer survivors optimize their health through evidence-based dietary strategies. So welcome. Thank you for joining us today.
Thank you for inviting me. I look forward to our conversation today.
Oh, awesome. Me as well. So let's get started then with a big picture question. You've had an incredible career spanning research, clinical practice, and education. What led you to focus specifically on oncology nutrition, and what inspired you to create Cancer Nutrition HQ?
So when I was an undergraduate in my last summer before I started my last year, I did some research with one of my mentors, and she was conducting research on how some of the bioactive compounds in tomato were impacting prostate cancer cell growth. And this was just petri dish research, but it really opened my eyes into the power of nutrition. I never thought about nutrition in relation to cancer. And of course, doing some research in relation to that project, it really got me interested in studying this further. So I went on to get my PhD and focused on nutrition for cancer prevention. But always having that dietetics background, I always wanted to bring that back into clinical practice. So understanding the research, but then how do you help patients with this? And as I started my practice and started working with patients, I was seeing a lot of misinformation that they were coming in with. Again, and it's just getting worse now with the rise of social media and the rise of
Sure.
misinformation. And so I really also made it a priority to try to communicate that science online as well, because I know there's a lot of misinformation that can sometimes be harmful for patients. So I never set out that I'm going to go be an oncology dietitian. All it took was one experience that really opened my eyes into the power of nutrition. And then after working with patients, I said, okay, we need to do more to help individuals